Here are this week's top stories. Arab Health welcomes more than 120,000 attendees in its 40th edition. Dubai Health Authority launches new projects to advance medical tourism. And find out how running improved the lives of these young runners at the Super Sports Run. I'm Rachel Pather. Welcome to What's Up. Now in its 40th year, the Arab Health Exhibition and Congress opened with Dubai ruler His Highness Sheikh Mohammed bin Rashid Al Maktoum officially inaugurating the event. Sheikh Mohammed toured the exhibition stalls and stopped by the Dubai Health Authority stand to inquire about the new healthcare packages. Arab Health is the region's biggest healthcare expo, with around 4,000 exhibitors from around the world and more than 120,000 people in attendance. Dave Panther, Exhibition Director at Arab Health, talked to Physique TV about this year's event.
The 40th anniversary of Arab Health, so far 3 days in, and we're having a fantastic time. The numbers are huge and increased from last year, I think. We've got lots of people all around to find out the newest technologies, the latest innovations from all of the key healthcare companies around the world. We're also welcoming a lot of visitors from outside of the GCC region as well, for more than last year.
Being a widely attended event, Arab Health served as an effective platform to showcase just what Dubai has to offer to the world. This is why medical tourism was a big highlight for Dubai at this year's exhibition.
Arab Health brings the healthcare industry together. Dubai is a great hub for all tourism. Medical tourism is an easy way for them to showcase how the healthcare system has developed here and how comparable it is to Europe, to America and to Asia. We have all the hospitals taking part, and while they've got the opportunity to show the facilities that they have, healthcare, medical tourism is something that they are able to promote as well.
At the Dubai Health Authority stand, several new health services that the authority has introduced were presented, as well as the developments in the Medical Tourism Initiative.
With the directives of His Excellency, the Director General, Engineer Issa Al-Maidour, Director General of the Dubai Health Authority, we have launched the Dubai Medical Tourism Club, which is a club designated for the medical tourism facilities to come together, discuss plans for marketing, for improving the quality of services, and also for us to be together as a forum of thinking how to take forward this initiative that was launched by His Highness Sheikh Hamdan bin Mohammed bin Rashid Al Maktoum back in 2012, and when the strategy was given to us to start working on it and implementing it in the best way we can. At the moment, we are in discussions with a couple of companies to come up with a designed medical tourism insurance that will give a great coverage for those medical tourists coming into Dubai for any complications that may arise, because as you know, any surgery or any procedure that can be done can have complications. So these complications will be covered by this. It will not substitute the travel insurance because that is a separate issue. However, it can be incorporated within this package of the medical tourism insurance. So we want to give the medical tourist who comes to Dubai complete package. He needs to come and feel he is protected. We have our clinical governance office procedures that will cover him in terms of any risk that can happen with the process. We're also looking at launching a performance management for the hospitals in Dubai. Not necessarily only those who are doing medical tourism, but in general, this is something that the Health Regulation Department is working on, and with it will come the hospital ranking. So the patient can log onto the website, check the credentials of the doctors, check the procedures that are being done in so-and-so hospital, and they can know also their ranking in terms of performance, and this will be benchmarked against the best practices in the world.
The DHA has named premier healthcare companies, advocating the medical tourism strategy. And Physique TV was able to get an update on what projects are being pushed forth to meet Dubai's targets.
Actually, Saudi German hospital groups, we are a group of hospitals based in Saudi Arabia. We are 4 branches in Saudi Arabia, in Jeddah, Riyadh, Medina, Asir, and 1 in Yemen, Sana'a, and 1 in Dubai. We are focusing on medical tourism as a group of hospitals. We have a change. All of our hospitals are tertiary hospital, big hospital, more than 300 beds capacity. Also, we are last year in 2014, we are there in MTech exhibition. We met a lot of agencies distributed all over the world. We had an agreement of all of them to sending a patient to our hospital here in Dubai. Of course, we are planning to have more facilities in our hospital. We are building now extension for the hospital for the oncology department. Also, we are starting to make a specialized center for diabetes, internal medicine, obs and gynae, pediatric centers, as well as an plastic surgery extension.
Arabsat DM Healthcare is one of the largest healthcare providers in this part of the world. Now, DHA has come up with a lot of plans to attract patients from all over the world, especially Middle East and the African continent to Dubai. So we work very closely with DHA. In a way, our expansion plans, our growth plans are very much in line with the vision of Dubai. So we are also looking at more opportunities. Now we have, as I said, 3 hospitals are already in pipeline, and we are looking at more opportunities. Now we are expanding to Abu Dhabi. We are opening one exclusive mother and child boutique hospital in Dubai under the brand name of Medcare, that is scheduled for launch towards end of this year. And we have an exclusive sports hospital, exclusively for spine and ortho. And again, we have a very clear expansion plan till 2025.
Now we have many services that we are promoting for medical tourism, especially that of plastic surgery, and that plastic surgery comes mainly from GCC market, especially Saudi Arabia, and from Asia and Russia for special services like oncology services and family medicine also. It's a surprise that you'll find certain people coming for tourism, and by the way, searching medical services for family medicine and specialized dental services like implants and the maxillofacial surgeries.
The Mediterranean diet became a worldwide trend in the last couple of years. But now, in 2015, a new regional way of eating is making a buzz in the healthy scene, the Nordic Diet. The Nordic Diet is based on food originating from Denmark, Finland, Iceland, Norway and Sweden. It is based on 3 central themes. The first is eating less meat and more plant-based food. The second is eating more food from the ocean and lakes, particularly fish and shellfish. And lastly, eating more food from the wild countryside, such as root vegetables, wild game and berries. A newly released study from the American Journal of Clinical Nutrition proposed that following a Nordic-style diet will not only save you money, but it may also help reduce inflammation, which is a precursor to all sorts of chronic health conditions like diabetes and heart disease. Now don't go anywhere. We'll have more stories when we come back. We've seen elite runners and Olympic champions run at the Dubai Marathon. But at the recently concluded run by Super Sports, it was very refreshing to see young runners crowd the start line, all aiming to reach their personal best. Race director Warren Vandermeer shared that it's great to see the youth engaging in sports events here in the UAE.
This is the first time Super Sports has been involved in organising a race like this. It's basically a collaboration of a whole lot of American schools that come together and do a cross-country run, either 3 kilometres or 5 kilometres. It's part of an internal league that they organise, and I think today we had close to 250 runners from the different schools. It's unique in that it's just for kids, this one. It's very competitive. The athletes are grouped in teams as well, so there's a team prize for them as well. And yeah, the distances, it's a 3 kilometre and a 5 kilometres. You can see from the way the schools have been pushing it, 250 kids to come and participate. It's really good.
We were also able to speak to some of the young runners about their love for the sport.
I started running in middle school when I was in grade 7. I started off struggling with long distance running, and then after that I picked up my pace and I managed to run around 5 km now, and I'm really proud that I could run a long distance. I believe that you could gain confidence in yourself and that you could improve your body strength, such as improving your leg muscles, your abdominal strength and all that.
I like running because it keeps me fit, and I like running and long distances, short distances, and to keeps my legs healthy and to stay walking healthy and stuff.
Well, I started running because it really pushes myself to do better, and it really helps me do better in life because I wake up earlier to run and I have to sleep earlier. So it helps my schedule. I've noticed that I'm a lot fitter and I can run faster and stuff. And I've also noticed that I'm more energetic. It really boosts my metabolism also.
I started to run as a sport because it was very fun, and in our school we started to do exercises like doing the mile, which got me started to do some running, and then we had the team as cross country, so I wanted to start that team. I feel I'm a lot healthier and more fit, and I feel a lot more fresh after running, and yeah, it helps me a lot. It's really nice.
I started running to get more fit because I wasn't doing really any other sports, so I just thought that running was a good sport because I've always been okay at it. So I did it to help myself improve even more. Become more fit for sure, and I'm capable of doing things I haven't done before. For example, I never thought I would do 5K because I only joined in January, but now I've been doing it and it's so easy, and I just improved overall for my fitness.
Running really helped me because it helps me feel more confident. It helps me get my fitness on because a lot of people say they're overweight but stuff, but running really helps you and it really helps your fitness. When I started running, my stamina instantly improved and my legs got stronger. I enjoy running a lot. I do it for fun. I came here because I wanted to make the school proud.
I started running because I thought it would be healthy for my body and fitness. And so when I'm older, I can do more things. Physique TV, be your best!
I'm Amy and here's what's coming up this week on Physique TV. This week on The Good Life, Gabriella is at Eden Beach Club to attend a stand-up paddling class and also to learn how to make delicious sushi from Japanese chef Masanori Ito.
Hi Corey, welcome to The Good Life. I'm Gabriella.
Thank you, Gabriella. It's great to be here.
Today I'm going to learn how to improve my stand-up paddling skills. I've done it once before. I learned from a stand-up paddling...
Yeah, world champion?
Yeah, exactly, the world champion.
Great.
So I was in good hands, but I feel like my skills are quite basic. So I'd be excited to see what else I can add on.
Yeah, sure. There's many things that we can do. Basically, some turns, doing some turns, and then going into some stand-up paddling fitness, where we can do a little sup-fit circuit, stuff like that. Some long distance stand-up paddling.
Rio de Janeiro is famous for many reasons: carnival, soccer and samba music to name a few. But Red Bull's Desafio no Moro brought an entirely different element to the bustling city of Santa Marta Favela. In this week's Pushing Boundaries, a downhill mountain bike contest ran a course through the jam-packed hillside district with the sport's top riders.
While the riders took trial runs, we found out more about this unique and challenging course.
Such tight little alleyways, and there's no room for, big jumps and drops, but they have managed to fit them in. They've managed to build wooden platforms and landings and takeoffs in places where you wouldn't think was possible, and they've done an amazing job.
It's probably the most difficult street course I will ever ride. The course is tight, it's a lot steeper than the tracks we normally ride. The stairs are wet, we have animals on them, and there's all sorts of obstacles in the way, so, I think it'll probably be the most difficult course I will ever ride.
With their theatre secured, the dance group shift into high gear for preparation for the big premiere show. However, friendships are stretched to their limits when Teddy is sidetracked by his pet project and Nick is stressed over choreographing his solo.
I'll tip over this way and then pull it.
So here's a question.
Back.
Listen to what I'm going to say here.
No, it's fine.
See, like this, because you flip back this way. If that's on the edge, like how you did this one.
Start putting them back on.
Look now. See how you did that one?
I'm trying to provide solutions. People want to change the choreography. Done. I changed the choreography. People are still afraid that it's not going to work. I'm not being heard, and it's frustrating the crap out of me.
They're doing everything they can.
I know that, Ted. I said I'm gonna change it. It's not gonna happen. If it does come off or crack off, then we have a whole 15-minute or 10-minute intermission to fix it before we have to start using it again. It's like a wood shop back there.
They're doing all they can, bro. You're yelling at them?
No, I'm not yelling at them. I'm just saying.
Then lose the attitude.
I'm not having attitude, Teddy. I'm just saying it's an easy fix. I'm gonna change it, the section, and it's gonna be fine. Get them, put them on. I just don't care. It slides. It's fine now. That's all I was worried about was the sliding, and the sliding has now been fixed.
I just, yeah.
Drop the attitude. Why don't you drop off the face of the earth?
For our full schedule, don't forget to visit the Physique TV website. I'm Amy, and I'll see you next time.
Again, here are this week's stories. Arab Health welcomes more than 120,000 attendees in its 40th edition. Dubai Health Authority launches new projects to advance medical tourism. That's it for this episode. Once again, thanks for joining me today. If you have any comments or suggestions, feel free to reach out to us on our social media pages. I'm Rachel Pather. See you next time.